Hello and welcome back to the channel. If you're new here, my name is Mohammed. I'm a core surgical trainee working in London. Well, I'm not in London at the moment. Last week we talked about how to revise for your medical school anatomy exams. This week we're back with a video about how to revise for your membership of the Royal College of Surgeons examination Part A. Now, I sat this exam in January of 2019 and it was possibly one of the hardest exams I've ever sat in my life. Luckily, I passed and I've got some pearls of wisdom to share with you guys today. Now, this video is being sponsored by KenHub, who are a leading anatomy platform that I've personally used for my MRCS Part A and DONS examinations, and we'll hear more about why they're special towards the end of the video. Now, let's start with the first seat, that of context. The vast majority of medical school graduates from the United Kingdom will likely become general practitioners, they'll become GPs, and a deep and elaborate understanding of surgery, surgical principles, anatomy is actually not required on a day-to-day basis. As a result, medical school curriculums have been systematically reducing the amount of anatomy and surgical teaching that they offer. This probably means that you're underprepared for your MRCS Part A examination just out of medical school, and you'll be needing to do quite a fair bit of work yourself. So the aims of this exam are actually split into the 10 modules of the syllabus, which I'll link in the description below. And that's of basic science, common surgical conditions, basic surgical skill, assessment, management of the pre-operative patient, and as well as that of the surgical patient, assessment and treatment of patients with trauma, surgical care of the pediatric patient, management of the dying patient, organ and tissue transplantation, as well as professional and leadership behaviour. So you're sitting your MRCS exams to be entered into the surgical profession, and thereafter you'll have a good foundation to build your specialty training on, and eventually sit your FRCS exams to become a specialist in the surgical field of your choice and exit as a consultant. Now, the other huge difference with this exam and any exam you've probably ever sat in your life is that this is likely the first exam you'll be sitting whilst you're working full-time. You will likely be in your foundation years, although some people choose to sit in their core surgical years, and you'll likely be working between 40 to 48 hours a week. Now, the advice I give people about sitting this exam is that you want to choose a time in your foundation training or potentially your year off where you have the lightest workload. Most of you will be working 40-hour weeks with an on-call rota on top. So you likely want to do this exam when you have no on-call rota or a very light on-call rota. And the foundation rotations that suit this the most are the ones where you're supernumerary, so radiology, oncology, intensive care, and then the ones that have a very light on-call rota, things like general practice, psychiatry, urology, of the surgical specialties. So that will give you the most amount of time to actually revise for this exam. The other consideration is that you likely want to do this after your general surgical rotation, because you will likely want to see a lot of these conditions in real life and see how your consultants and registrars manage these patients, as well as also creating a few contacts within the foundation and SHO team, as there may be other people that want to sit this exam that will be great allies for your revision, as well as having some senior personnel that you can ask for advice. I certainly found it very useful to have some surgical registrars that I knew very well that I could ask about, things like what the hell is a stoma, and why are we putting it in the left and the right, and what do we do in these emergency situations versus a malignancy situation, which is a key focus of this exam, because these are the principles of the exam. So you've now decided which rotation you're going to sit it. You need to decide how much time you want to allocate to revising. Everyone is very different and everyone has different levels and practices of revision. I do not like to have a prolonged period of revision, whereas most people advocate for a 3 to 6 month period to be familiar with the topic and then start revising. That period of time will likely cause me to burn out. So I chose for a more intense 10-week block that was split into a 2 and an 8-week period. And this is generally how I revise for most of my exams. I have a 2-week period where I look through the content and decide what needs to be done. and then I'll have an 8-week period of time where I just go in and I revise every single day, and I go very intense with it. And that seems to work very well for me. It's very important to look within yourselves and see what works best for you and what you can get away with. The last thing to mention about timing is that it's very important that you also use your annual leave and your study leave very effectively. What I used to do was I used to do a lot of Fridays off, so I'd have a 3-day weekend to revise for the exam, and then I was very lucky in that I managed to get some study leave to actually revise the week before my exam. And I really would advocate you playing around with your rota to ensure that you have a good chunk of time to revise for the exam. Now, the second C is that of concept. Again, with any revision, any exam that you do, it's very important that you adhere to the core principles of revision, that of active recall and spaced repetition. I've done previous videos about this, but active recall is essentially you producing the information from the depths of your memory in an active manner, and this will be more likely to be retained within your memory. And that of spaced repetition, meaning that you need to revisit something multiple times before you sit your exam. The next step is to look through the MRCS syllabus to understand what is required from you and where the gaps of your knowledge are. It's likely that some of the stuff you would have covered during medical school, and it won't be the first time that you're visiting some of these topics, and there will be other topics that are brand new to you, and you probably need to spend a bit more time to understand the key concepts within. And as with all anatomy or surgical exams, there'll be some topics that you will require very deep knowledge for, like the management of large bowel obstruction in the context of a perforation, adhesions, or malignancy, because each one will require slightly different things to be done. And there will be other things that will be very basic, like the ligaments within the knee and what the presentation is of patients with problems therein. So for the last C of content, I thought it would be useful to go through step by step exactly how I would revise for an exam like this. So the first thing would be to understand what I'm getting myself into and to really commit to a 10-week slog of revision. It's not going to be a pleasant time, but it needs to be done. I actually really enjoyed the revision part of my MRCS exam because I really enjoyed the subject field, and it was almost a reassuring thing that I enjoyed the surgical content, because I knew that I was getting myself into a good profession, or one that was very well suited to my skill set. You then have to book the exam and pay the 600 something pounds, which you can get your tax back on, and I'll do a future video on how to get your tax back. You then would book your study leave and your annual leave to make sure that you've left enough time for you to actually revise for this exam. And most importantly, you need to book yourself a holiday after the exam to reward yourself for the time that you've committed. For the 10 to 12 week slog, it's very important that you have two main resources: a good past paper bank and a good anatomy reference tool. Now, for the past paper bank, this is going to be your guide to revising. You'll likely need to go through the bank maybe 2 times, maybe 3 times before your exam. It will give you a good idea of what sort of questions are asked and the depth that you need to go to for each subject, and also which types of content you need to visit. If you find that there's a question that's being revisited multiple times during the question bank, this is likely a high yield question that you need to understand and know the principles of really well, and is probably a key or common question that gets examined in these MRCS examinations. There's only a limited number of questions that they could possibly ask for an entry exam, and so these past paper banks will likely cover most of the topics. So you will be quite safe just going through a past paper bank and then pulling out every time you get a question where you find it very difficult. I would then go to your anatomy textbooks or your anatomy websites and read more about the topic. And when you come across a question that you find very difficult, I think it's very important that you then look at articles, websites, look at your physiology textbooks, look at your anatomy reference tool to find out a bit more about the subject field. The second tool that I mentioned is that of a good anatomy reference tool, because the first paper is going to be very anatomy focused. It's very important that you know your anatomy well. So for my anatomy reference tool, I use KenHub, which is a cross-platform website. You can use it on your phone, your tablet, your laptop. You can use it on the move. I find it very easy to navigate the website, to save, to reference articles, to add to my Anki cards, to add to my notes. And most importantly, it is very beautifully laid out. The articles are always very clear. There are even videos to allow you to further understand the topic, and most importantly, they're using evidence-based tools to help you revise better. There's a fantastic quiz where they present different parts of the body, different anatomy parts to you, and they will then repeat this based on how well you answer those questions. So if you do it very well on the questions and repeatedly answer it correct, they won't show it to you again for a period of time, and if you're getting it incorrect, they'll keep showing it to you. They've got this beautiful algorithm that really helps you retain information. So I really do suggest that everyone checks out KenHub, and if they like what they see, there's a discount link in the description below. So now that you have a good anatomy tool and you have a good past paper bank, you're ready to put in the 10 weeks work and then sit your MRCS exam and start your career in surgery. If you have any further questions about MRCS examinations, drop a comment below and I'll either produce a video or drop you a reply. And yeah, thank you very much for watching, and we'll see you shortly.